Hi, I'm Jodie Rosé-O'Brien, part of the AWI Extension South Australia team.
This 10-minute talk is in two parts. Firstly, we're going to hear from Ollie Clothier, a farmer from Lucindale in the state southeast, who contracted Q fever in 2013. And then secondly, we're going to hear from Dr. Scott Lewis about Q fever, its signs and symptoms, prevention of Q fever and vaccination.
Ollie, tell us a bit about yourself.
Ollie Clothier, we farm in the southeast of South Australia, north of Lucindale. We run sheep and chooks enterprise.
How many breeding ewes do you have?
So we run about 2,500 crossbred ewes and 800 merino ewes, nearly self-replacing flock.
So we're here to talk about Q fever. So when did you get Q fever?
So I got Q fever in 2013 when I was helping on a family friend's station in the northeast pastoral.
So how did you know you had Q fever?
I got pretty crook. Come down with a flu-like symptoms. Fever, was hot, couldn't, ended up going to the hospital and was there for 3 days, and then they flew me to Adelaide, and they didn't really know what was going on. Until I got a blood test, was positive for Q fever, and I hadn't had the vaccine or anything before, so that's what they deemed it to be.
So how long was it approximately from when you were exposed to what you think, where you caught it, to like being unwell?
It was a couple of weeks. It was probably about 2 weeks. So
let's just go back to when you first got Q fever. What were you doing? Were you just working in the yards, or what sort of activities were you doing?
So we were doing a bit of crutching on a crutching trailer, and we were mustering goats and catching goats and doing sheep work. And
so from the dust, is that what they thought?
It's everywhere. Well, it got deemed to me that it was sort of everywhere in the dust and in the environment.
So what were the short-term impacts and the longer-term impacts of having Q fever?
Short term, I was fatigued for probably a good couple of months afterwards. Long term, it wasn't anything too bad, that I know of.
Because there is versions of the longer term of the disease, but you've been fortunate enough not to have that.
Yeah.
My name's Dr. Scott Lewis. I'm a rural doctor who has spent all his career working in rural areas, most notably in the small community of Wudinna in South Australia for 14 years, but now working right across South Australia in a number of different roles. Q fever is a almost uniquely Australian thing. It was first discovered in the 1930s and is a bacterial infection caused by a bug called Coxiella burnetii. It's an infection that you get from livestock. It's most commonly found in sheep, in cattle and in goats, and is a real risk for almost anyone working in those industries in Australia. And we do see it in native animal populations as well. So those people who work closely with native animals are also at risk of picking up the bug. So Q fever is contracted by being in contact with fluids from infected animals. Really, the risk of Q fever is highest around the time of birthing, so when you're lambing, when you're calving, but also actually when you're shearing as well, because Q fever can be found in wool and wool products as well. So really, it's not a particularly a month or a time of the year. Anytime you're having close interaction working with livestock, there's a potential risk of exposure. So Q fever is an illness that presents with what's best described as quite a severe flu-like illness. People often present with severe fevers and high fevers, muscle aches, severe headaches, and feel really quite unwell for several weeks at a time. It can be quite debilitating, and symptoms can often last up to 6 weeks. Death is rare, but certainly if you have severe inflammation of the heart, it's a possibility. But the really significant thing is the long-term chronic fatigue type illnesses that can be really quite debilitating and take people out of the workforce for a very long period of time. Q fever can be avoided in 2 ways. If you're working with livestock, then it's also very important to take precautions, especially if you haven't been vaccinated against Q fever. And that involves wearing of masks, avoiding dusty conditions where you might raise the bacteria up. And for those people who are back at home, if you've been dealing with birthing products or other high-risk fluids, then take your clothes off, bag them up or wash them in a hot wash very early after you get back, because there is a small chance of exposing family as well. But really the main way of preventing Q fever in Australia is vaccination. Vaccination is an Australian developed vaccine and is highly effective against Q fever. It's a bit of a different procedure to get vaccinated for Q fever, because one of the most important things is to make sure that you haven't been exposed to Q fever before we give you the vaccine. Because if you have and we give you the vaccine, it can cause really quite a significant illness. So vaccination for Q fever is generally done over 2 visits. In the first visit, we will take your blood to check your immunity, and we'll also give you an injection of an extremely small amount of the vaccine into the skin on your forearm. What that is testing is previous exposure and immunity. If those 2 tests show that you haven't been exposed before, then a week later you can have the vaccine, and that is just a single dose that then protects you for life. The vaccine is available for anyone over the age of 15, and certainly for anyone working in and around livestock in Australia, we would strongly recommend vaccination. One of the biggest issues with Q fever is the potential to take you out of the workforce and take you away from your work for a significant amount of time. Q fever illness can be really quite severe, and I've had patients who have spent months unable to do their jobs, unable to look after their farms and unable to look after their livestock.
So some great advice there for other producers and people working with livestock and other animals that carry it to be vaccinated. So any other tips for producers that to prevent Q fever?
As soon as you turn 16, get vaccinated for Q fever.
Thanks for sharing your story.
No worries.
Q fever vaccination is available from the following providers, sourced from SA Health. Thank you to Ollie for sharing your experiences with Q fever, and to Scott for sharing his experience and professional knowledge. This 10-minute talk was made possible through funding from Australian Wool Innovation, the South Australian Sheep Industry Fund, and the Department of Primary Industries and Regions.